and then it breaks it down by weight and all the other kind of things. These questions are the kind of questions, especially for New Haven, right? So when we look at so I didn't pull up any of Yale Care's statistics, but when you look at, these are the kind of questions, even more so than what's the number, right? And when you hear the number, the next question you should be is, who are these people? So what is this breakdown? What are the age groups? You're thinking right.
Why is that an age that is so, like, where the most of the deaths are happening? Like, because you would think, so from the statistics you gave, it's like most of the deaths is happening between 29 really and 34. People think of that being a healthy age to have a baby. So why is most of the infant mortality within that age range? Is there an answer? I should say, is there an answer? I know I'm asking you to solve the world here, but
I don't have any statistics to back this up. I don't have any, any statistics. I haven't done any sort of research into this kind of thing, but I believe that these are the kind of questions that you need to ask, and it's just a hunch. I'll just go out there on a limb. This is my opinion. It's not based on medical fact or any kind of research that I've done. But it is my opinion that is when women start to worry about their fertility or their infertility, or the push is on to have a baby, right? In our society, traditionally.
So
right?
Is it stress?
I would think that there's partly stress, but I think that some of these are infertility rates here, right?
So people who already have existing medical complications or problems with fertility, with an increased risk of infant mortality.
Right, because what is infertility? It is when you're having unprotected sex for a full year and you fail to conceive, right?
Okay.
And then you go into
the
technical definition, unprotected sex for a year, for a year's time, and you fail to conceive, you haven't gotten pregnant, right?
Okay.
And so these women are, having sex or hopefully in relationships, and they're not getting pregnant, so then they would seek
part of it.
They would seek, fertility treatments. Maybe they get pregnant, but then might be other circumstances that cause them to be in these statistics for infant mortality.
So this has been a very interesting conversation. Certainly not long enough for our 50 minutes that we've had.
Okay.
So as we wrap up the show, give us a pearl of wisdom around how to give yourself and your child the best chance, and any other thing that you want to leave the audience with.
Like, I'll end where I started. Preconception health, this concept of being the healthiest that you can be, right? Even before you get pregnant, is the best chance that I believe you can still with everything, it's still the best chance that you can give your unborn future children. So, having healthy weight, not smoke. Please don't smoke. Don't start smoking if you're not smoking. Don't smoke. Don't smoke. The amount of alcohol that you drink, it provides the best opportunity for having the healthiest, highest birth outcomes. Preconception health. And so if we do nothing else, all of the in my public health mind, you can see overall general health way before, 10 years before you're actually thinking about getting pregnant is really the best.
So I think if you ever want to have a baby one day, you need to think about your health now, even if it's not for 5 or 10 years.
Okay.
So that is a great way of thinking about it, and I want to thank you so much for joining me. This was very interesting. If you want a little bit more information, I normally post all of these links on the website and on the Facebook Live. You can check the comments on the Facebook Live. I'm going to put the CDC site. I'm going to put some other, the unnatural causes link. And I want to thank you for listening. You have been listening to 103.5 FM on your radio dial. And this is New Haven's home for community radio, also streaming live on newhavenindependent.org. I'm Mubaraka Ibrahim, and this was Mornings with Mubaraka, your Wednesday morning voice. Remember, we want to be your voice and discuss topics that's relevant to your life. So go to our website, morningswithmubaraka.com, click on the Contact Us tab, and suggest a show topic or guest, or give us feedback. You can join the conversation on Facebook or Twitter. You can look me up with Fit Muslima or use the hashtag Be a Voice. I want to thank you for listening. I'm Mubaraka Ibrahim, encouraging you to be a voice and not an echo. Awesome.
Are we on?
That was great. Yep.
Are we on?
Yes, that was really, you were just like a teaser though. You were a teaser. You're like, you say something and then you're like,
I'm sitting there and I'm saying, oh my God, I can't believe I just said.
Thank you for watching.
I just said.